Hi, and welcome to the webinar. My name is Dr. Darla Bell with Owasso Physical Therapy and Pelvic Health. I am a physical therapist specializing in pelvic floor dysfunction and treating the pelvic floor. And we're going to be discussing some of the more common issues that women have related to the pelvic floor. So some of these can be urinary leaking, pelvic organ prolapse, pain with intercourse, and diastasis recti, or you can say diastasis recti. You might have heard it that way. So I'll go further into detail about each one of these during our time together, but I'd like to start with what exactly is the pelvic floor. So as you can see on my model here, the pelvic floor are these groups of muscles and tissues here at the base of the pelvis. They form kind of a sling or a hammock, and they support the pelvic organs, which are the bladder, urethra, intestines, and rectum. And for women, this can include the uterus, the cervix, and the vagina. So these muscles help to provide support of the pelvic organs. They also work for hip stability, bladder and bowel control, and sexual activity. So one of the most common things that I treat in pelvic floor therapy is urinary leaking. And this can happen with a laugh, a cough, a sneeze, when you're playing with your kids, running, jumping on the trampoline, or when you're trying to exercise. Sometimes it's with an urgent need to go empty your bladder, and we're just not fast enough to get to the toilet, and we leak on the way. These are normal. They're common, not normal. They occur with aging and after having babies, but it can be reduced with pelvic floor therapy. The other thing that I treat a lot of is pelvic organ prolapse. And this is when those pelvic organs kind of drop or slip a little bit lower into the pelvis. And you can feel a heaviness or a pressure in the pelvis. And it can sometimes worsen to where you feel a bulge pressing into the vaginal wall. And this can occur a lot of times. Let's say this is your pelvis, and we have some pressures, that intra-abdominal pressure when we exert ourselves, like with a laugh or a cough or a sneeze. Also, when we're picking up our babies, when we're picking up groceries, laundry baskets, and that little bit of exertion when we kind of grunt and bear down while we're picking things up can cause those pelvic organs to just drop a little bit. They lower under that strain of that pressure. And there's just not enough strength in the pelvic floor muscles to provide that support underneath to hold against that pressure. So what we do in pelvic floor therapy then is strengthen up those muscles to give you a little bit more support. I'll teach you about how to watch those pressures to protect against that increased intraabdominal pressure pushing down on the pelvic organs. And then after we strengthen that up, it'll improve your function and your control. Another thing that I like to do that I treat a lot of is pain with intercourse. Some ladies will come in and describe a pain at the vaginal opening with that initial penetration, or deep into the pelvis, like bumping into something or running into a wall. Sometimes it's described as poking a deep bruise, a burning or sharp pain, or a cramping or spasm during or after intercourse. There's several things that can cause these types of symptoms. One is overactivity in the pelvic floor muscles. This is when your muscles just get tight and they don't relax very well. There's an increased tone, so they're tight and staying tight. And these tight muscles become short and weak, and they can lead to dysfunction and pain. Tight muscles can also entrap some of your nerves. As you can see here on the pelvis, this yellow right here are your nerves running through the muscles here. And those tight tissues can pinch down on your nerve. So let's use this as an example. Your nerves run through a sheath, kind of like a string runs through a straw. And so when you move or put tension on that nerve, it slides or glides through that sheath just like it's supposed to. But when your tissues are tight, or you have a muscle that's pushing down on that sheath, when you put tension on that nerve or contract that muscle, it's going to pinch on that nerve, and it can't slide or glide like it wants to. And that nerve can get angry. It's not going to like getting squished. And so that's where you can get some of that burning or sharp pain. Another thing is fascia restrictions in the pelvis can contribute to some pain and dysfunction. Fascia is a connective support tissue that covers our bones, muscles, organs, blood vessels, and it provides support to all of those tissues. And it's if you've ever made ribs or a steak and you've pulled that silvery sheet of tissue off so your meat's not chewy, then you've seen fascia. And that fascia can get tight around those muscles and cause some dysfunction or pain. So we look at that in pelvic floor therapy. We also look at the coordination of your muscles. We want to make sure that they contract and relax in the right rhythm. Sometimes there can be some uncoordination in the muscles to where they're contracting and relaxing all at the same time, don't know if they're coming or going. And so we look at that and help to retrain those muscles so that they're contracting when they're supposed to and then relaxing when they're supposed to, so you have normal function. And the other thing that I do for pelvic floor therapy is that diastasis recti. And what that is it is a thinning of that connective tissue in your at your abdomen. And so the linea alba runs from your sternum all the way down to your pubic bone, and that's where those abdominal muscles attach. You have 4 layers of abdominal muscles, and they help you bend and twist and keep you stable, kind of like a girdle. They cinch in and keep you upright. But when that tissue thins, and it can thin normally during a pregnancy because that tissue is going to lengthen and expand as the belly gets bigger. But then after delivery, sometimes it can stay thin. And that can cause some doming or bulging when you try to contract the muscle. And it can cause the belly to protrude a little bit because of the weakness in the muscles. Now, your abdominal muscles like to work with the pelvic floor. They contract together. So when you can strengthen the core and the pelvic floor together, then you're going to improve your overall stability and function in both those muscle groups. It's going to help you feel a whole lot more put together so that you can run and jump on the trampoline and do all those things with your family that you want to be able to do. All of these issues are very common with aging, having babies, but it is not normal. They're all related to that pelvic floor dysfunction, and the good news is that they can all be treated successfully with pelvic floor physical therapy. So what does that look like? So what I do as part of an examination is I assess your muscles and tissues to find out what's contributing to that dysfunction. First, I'll look at your overall general movements. What do your patterns look like? What is your pelvic alignment? What's the strength and flexibility of your spine, your core or abdominal muscles, and your glutes or your hips? And then with your consent, your permission, I would do an internal pelvic exam to feel the pelvic floor muscles. Are they overactive? Do you have some increased tone there? And then I would just check your strength, your endurance, and your coordination. The internal exam is just a digital exam, meaning I just use my hands. I don't use any tools. Typically, I only perform one exam on your first and maybe your last visits, unless there's some reason to reassess in the middle because you're not progressing. So that means that you stay dressed for most of your therapy. Treatment is usually based on the exam findings to address any pelvic floor muscle dysfunction. Manual therapy is helpful in releasing some of those tight fascial or muscle restrictions. If you have any, we can release those adhesions with manual therapy. If the muscles are tight or spasmed, then I help you to retrain those muscles to lengthen them naturally and get them back to a more normal and a healthier resting tone. And then we help to strengthen those muscles up with exercise to help improve that coordination and that function. Pelvic floor treatment times can vary based on how your body responds to treatment. Most of my patients coming in with pain have reported reduced pain after the first visit, and all of my patients have been able to return to normal activities without pain or leaking after 6 to 12 visits. There are a lot of benefits, many benefits of pelvic floor physical therapy. The most important is getting rid of any pain, restoring intimacy with your significant other, helping to increase your function for returning to your normal activities with strength, confidence, and no limitations. So if you are ready to heal your pelvic floor, the next step is to schedule your evaluation. This is a 1-hour appointment where you can tell me your story, and then I'll assess your muscles and tissues, as I mentioned before. Again, I typically only perform 1 or 2 of those internal pelvic exams during the course of treatment, unless it becomes medically necessary or you aren't progressing and we need to reassess. I'll always ask you for your permission, and you always have the right to tell me no, so you are in control. I have an appointment set aside for those on this webinar. Click below to schedule your evaluation or visit owasopelvichealth.com/schedule. Thanks for being with me, and I look forward to meeting you in person at your evaluation.